I'm Dr. Krista Marie Singleton, a pediatrician and preventive medicine physician and the Associate Director for Science for the Centers for Disease Control and Prevention's COVID-19 Response Chief Health Equity Officer Unit. And I have had the honor and privilege to work with diverse communities and people around the country for the past 20 years. We understand that you may have questions and concerns such as, what has been the experience with vaccines for someone who looks like me? Will it be safe for someone like me and my family to get a COVID-19 vaccine?
My name is Michael Urquhart. I'm a cardiac physiologist. I have received my vaccination. I received my 2 doses.
Hola, mi nombre es Nancy. Yo me dedico a la limpieza de casas. Tengo 3 hijos y estamos en el tema de ponernos la vacuna, pero mis hijos no quieren ponérsela porque tienen miedo a la reacción, porque tuvimos una mala experiencia con la vacuna de la flu. Pero estoy tratando de convencerlos por el bien de ellos, por el bien mío y por el bien de mi familia y de las personas con las que yo trabajo.
Hello, my name is Mohamed Kisti. I am an occupational medicine physician and a public health physician. Vaccines are perhaps the best hope for ending this pandemic. While the journey to pandemic resolution may seem long, we can finally see the light at the end of the tunnel, now that we have the tools to potentially end all of this.
Some families and individuals have doubts or are concerned about the COVID-19 vaccination efforts led by the U.S. government. Some concerns are related to a documented history of the unjust treatment of minorities.
Between the 2 vaccines that are currently being administered in the United States, there were over 75,000 individuals enrolled in these vaccine clinical trials, including African Americans, Native Americans, Asian and Middle Eastern Americans like myself, people from older population, and from all genders. You can really see that representation here.
You may have questions about how COVID-19 vaccines were developed, why vaccines are as important as part of protecting yourself and your family from COVID-19, how you can get the vaccine, and when it is available to you.
Vaccine development technology has achieved many advancements over the past decade, in particular the messenger RNA vaccines, which was in development for many years. So while this may seem short time for the general public, this is almost overdue from a science breakthrough standpoint. Scientists and organizations around the world, for the first time, have all collaborated working together and invested significant time and resources that allowed such successful development of a safe COVID-19 vaccine.
My name is Victoria Blair Struess. I am an attorney. I work with families who have special needs individuals. It is very important to me to get vaccinated. I have registered with the Arizona Department of Health Services. I am very excited that the vaccination will protect me at a 95% rate from getting COVID. And even if I do contract COVID, I know that I won't get severely sick.
I am here to encourage you to voice your questions and to seek credible answers from trusted healthcare sources in your community, including doctors, nurses, pharmacists, and your local and state public health department.
As a healthcare worker, I know the importance of receiving the vaccine to show my patients that the vaccine is safe.
Although some individuals have reported mild to moderate reactions from the vaccine, they resolved completely after 48 hours without any long-term complications.
My doctor told me it's 70 million people they are ready to take the vaccine. So it's not only me, it's a lot of people they have the vaccine already.
In fact, my mom, who is 68 years old, is planning on getting her vaccination as she's done the research herself. She has learned that the risk of getting COVID is so much higher than any reaction to a vaccination.
I just got my vaccine.
The most important thing is to get the facts about the COVID-19 vaccine from credible sources to help inform your decisions. Your health and the health of your family and community have never been so dependent on the actions you take now.
COVID-19 is affecting the African American community at much higher rates than it's affecting Caucasian Americans. So please get the vaccine.
I'm Mike Thompson. I'm the CEO of the National Alliance of Healthcare Purchaser Coalitions. The COVID-19 virus is one of the biggest challenges that employers and their employees and their families have ever faced. I live in New Jersey, in a town not too far from New York City, and very near to my house, we have a memorial for 9/11. And when I pass by that memorial, it reminds me of how many lives were lost in one day in one of the biggest tragedies in American history. There are more people dying from COVID-19 every day than died in the entirety of 9/11. We need to get this right, and we need to do it together.
By getting vaccinated, continuing to protect yourself and others by wearing a mask, keeping your physical distance from others, and washing your hands often, you are part of the solution to stopping the threat of COVID-19.